Well, certainly what I'm proud of is the work that's been done in neuropharmacology, primarily I think linked with other good neuropharmacologists and psychiatrists within the UK. I've been fortunate in having some very top people working with me, often at the early end of their career. I mean, obviously, particularly, I'd like to mention David Nutt, Phil Cowan, and Guy Goodwin, I mean, who went on to become major personalities in the British psychopharmacology scene. But in doing that, I'm probably omitting, and I hope I don't offend them, a substantial number of other very senior people who I've had the privilege of working with, sometimes over fairly short periods because we've got together, decided we've got a joint interest in something, we've studied it, we've published it, and we've moved on. I think the work with David Grahame-Smith in Oxford, where we were looking at ways to measure 5-HT function, serotonin function, in animals with a view to understanding more how drugs work in psychiatric disorders, has been something that I'm particularly pleased with. And within that, I think the work we did on ECT, when people for years have been saying that ECT didn't have a specific mechanism of action, and we were able to show, at least in experimental animals, that if they got a series of electroconvulsive shocks under anaesthetic, in very much the way that ECT is given to severe depressed patients, then there are very specific changes in the brain, and those changes are certainly consistent with the way that some other antidepressants work. So we were seeing the same type of change occurring, and I think that gave a boost to actually psychiatrists to say there is a pharmacological type mechanism of action occurring. And I suspect partly a result of that, Tim Crowe and Eve Johnston at Northwick Park were able to do a clinical trial on whether ECT was efficacious, and showed that it was. And it gave a boost actually to the use of ECT in severe cases where no other treatments have been shown to be useful. The other work that I've been much involved with from, gosh, the early 1990s right up to now has been studies on what's sometimes called recreational drugs, ecstasy in particular, methadone more recently, finding out perhaps a little of what they're doing, and again how dangerous they are if young people take them, and trying again in current terminology, translation between animals and humans, and what to look out for, because we know that people are not going to stop taking recreational drugs. It's embedded, I think, in mankind as you look into it. But at best, perhaps suggesting that young people, if they are going to take them, should think about how much they take, what else they take with them on the basis of animal work has been pleasing. I mean, young people will continue to take these drugs. The more they're informed, I think the more they're able to make decisions as to how much they take, whether they mix them with other drugs, and in that regard it's been quite interesting that I'm getting back to linking with my old colleague David Nutt, who of course over the last few years has spent most of his professional life talking about relative risk of all these drugs. And you know, we have talked about this, and we've recently published on how research should be conducted on drugs, both preclinically and clinically, so we can believe in the results that we obtain.